So maybe we need to define that first for people that don't know what a PBM is or a pharmacy benefit manager and what your role and responsibility is in the health plan.
Welcome to the land of acronyms, right?
Yeah.
HMOs, PPOs,
yes,
right?
exactly.
HSAs, FSAs. So yes, let's slow her down.
So I think, first of all, you have to look at where the PBM industry is today and where it really should be, because what PBMs, we're going to put them into two buckets, right? The PBMs of the past and the new PBMs that are transparent pass-through like we are. I think the PBM world gets thrown into one bucket, and not everybody is created the same. Mm-hmm. So my PBM, VividClearRx, is actually all of our executive team is pharmacists. And I think that's important because truly being a pharmacy benefit manager, you should be a pharmacist with that knowledge and making good, solid clinical decisions while also being fiscally responsible. And so I think, putting people, keeping in mind that there is a person behind that prescription, behind that number, is really important. And that's why I became a pharmacist, was to help people become healthier and live a long, healthy lifestyle. And so really keeping those in line along with fiduciary responsibility and, costs are very important for clients, for them to be able to offer a good, healthy benefit for their employees. And I think, to truly manage pharmacy benefits is not chasing rebates. It's not, trying to figure out how much money you can get from big pharma. It's literally figuring out the most cost-effective way to treat what's wrong with those members, and doing follow-up to making sure that they're doing okay and really doing the extra. But prior authorization and getting the right drug for the right patient at the right time in the right order is also very important. And that, at the end of the day, is really what we're doing. We're racing to lowest net cost, and with the patient's health at the forefront of every decision that we make.
Yeah, well, I'll sum it up and say your goal is to meet business and science somewhere in the middle. And that's where we get off kilter a lot. Obviously, there's the profitability. And so for the listening and viewing viewers, the pharmacy benefit supply chain is you have the manufacturer, you might have a group purchasing organization, you have a rebate aggregator, and then you get down to the pharmacy benefit manager. And there's been a lot of people talking about pharmacy benefit managers, the middleman, as they're referred to. Whereas just a few years ago, our politicians would say, oh, these evil empire manufacturers. And somewhere along the way, some education was obtained by our politicians, and we started talking about pharmacy benefit managers. And so it's almost become, dare I say, a vulgarity to say PBM now, because now they've all been put in this bucket of like, oh, the middleman that are really ripping us off now. And so that's what we're trying to do, is just slow the ride down and let people know that, yes, pharmacy benefit manager might be a title here, but what are they doing? Where business meets science. And that's really the key for us too, because we see the financial barriers where people are getting medications at the pharmacy. They're paying $500 and they just turn around and walk out.
Yeah, exactly. And having been a pharmacist at that counter who has to tell the patient, hey, this is going to be $500, I knew before I even walked up there that patient wasn't going to be able to afford it. So we are working in the background in the retail pharmacy world trying to figure out, is there something else that they could be on that would be less expensive? Is there a copay assistance card that can help them? Because I know that when I go up there, they're just going to...
It's not just a transaction.
Correct. It's a person.
You're problem solving for someone.
And so, as a PBM, when you take that, sort of background and where you come from and bring that in, that is a difference maker, because I think for so long it's just been big business and the people don't matter.
Well, it just crushes you because, in Skip and I's position where we are meeting with clients and we're going to open enrollment meetings and talking to patients. And, we kind of see that side of it too, because I think sometimes employers don't think twice about raising deductibles or changing their copays on their medications, not paying attention to what their formulary says. And, if someone doesn't dispense that medication, well, now they might be going to GoodRx, or they're not taking the medication, God forbid. But then I always try and level set with employers. It's like, you're paying all this money to your insurance carrier, and your pharmacy benefit manager is not even, adequate enough for your people. So they're trying to find these other avenues. So why not work with a right partner where we can remove some of those financial barriers to care?
Well, and the thing is that we've really kind of taken to heart is all groups, as we've continued to grow, we've noticed that all groups are not created equal. So if you have employer group A and employer group B, employer group A may have, their struggles may be diabetes and whatever over here, and over here, mental health may be a big concern. Mm-hmm. So when you're looking at a formulary and you're looking at their spend, there's different tweaks that you can make. But if you're just running to get the most rebates or the biggest spread or whatever that looks like, and you're not taking into account a strategy for each individual group, then you're just contributing to the problem.
Yeah.